Welcome back to my channel. My name is Lynda Iruoma. I'm a community health practitioner based in Nigeria. On this channel, I talk about health, beauty, and lifestyle. Today, I want to talk on causes of high blood pressure. We talked about high blood pressure, the signs, the symptoms, the stages, and the meaning. If you have not watched the video, I'll leave the link down below. So today I want to talk on causes of high blood pressure, also known as hypertension. High blood pressure, hypertension. This is a condition in which the force of the blood against the walls of the arteries is too high. It can also be said as a persistent elevation of blood pressure above the normal level. Causes of high blood pressure, hypertension. Number one, age. The risk of high blood pressure increases with age. So the older we get, the more likely we might develop hypertension. According to research, as from the age of 64, the blood pressure tends to be high in men than in women. Number two, race. High blood pressure is particularly high in black than in white people. Black people tend to develop high blood pressure earlier in life than the whites. Number three, family history, also known as genetic. So if there is family members, your father, your siblings that have had an history of high blood pressure, there is 60% chance of you developing high blood pressure at a long run. Like, there's one advice I used to give to people, that our life is like a gun. Genetic diseases are like a loaded guns. Like, it's already inside our body, but it's left for you to pull the trigger before it starts manifesting. Like, you can help yourself by the kind of lifestyle you are living, the kind of things you have eaten, the how you look after yourself will determine if you will likely develop a kind of certain genetic disease as your family. Like example, if you load a loaded gun, except you pull the trigger before the gun can shoot someone. Likewise, our body, if you have any kind of, like, there is any kind of hidden genetic disease inside your body, then it now lets for you to for excessive weight or obesity. When you increase in weight, excessive weight, when you become obese, it affects the blood vessel. When you increase in weight, excessive weight, everything in your body changes. Both the blood vessel, the kidney, the overall function of the body changes. 5. Excessive intake of salt. A lot of salt, also called sodium, inside the body can cause the body to retain a whole lot of fluid, and this can increase the blood pressure. 6 is stress. As a human being, the best you can do for yourself is always try to get enough rest. There was a story I told on my other video about a man that collapsed in his bedroom. He wanted to take his bed and he collapsed in his bedroom. I so much believe that the cause of his own hypertension is as a result of stress. This man hardly rests. From Sunday to Sunday, you did not see him in the shop. He's on his way going to Onitsha to buy goods to stock his shop. When you deprive your body from rest, your blood pressure tends to rise, and you wouldn't like the complications that your body might face in the nearest future. Try to get enough adequate rest for your body, for your mind, and for overall good health. Number 7, smoking. Smoking tends to damage the blood vessel. When you smoke, the blood pressure slightly rise. And sometimes when you're used to smoking, when you smoke too much, when that blood pressure rise slightly, it may refuse to go back. So my advice is, if you are smoking, you reduce the rate of your smoking or you quit smoking. Number 8, pregnancy. When you are pregnant, your blood pressure tends to rise, but immediately you give birth, it will return to normal. So that one, there is no case to alarm, except it's too high. Then your doctor will now give you. Number 9, certain chronic condition like kidney disease. Hypertension is a serious medical condition, and this can increase the risk of kidney disease, heart disease, brain disease. So my advice, or what I always tell some of my clients and patients, is get a home BP apparatus. Use it and check your BP level. Whenever you find out that your BP is getting high or rise above normal, then you go and see your doctor. You visit your caregiver. Don't joke with your health. Don't joke with your health. If you made it far to this video, I appreciate you. Thank you so much. To my returning subscribers, thank you very much. I really appreciate you guys. See you in my next video. Bye.